you give me hope about the way things can work, because I'm sure it's been a long road.
Oh, sure.
But you'll do well.
Thank you so much.
Yep.
And on any given month right now, we're averaging about 250 people who walk in here. And then once they're here, they're immediately greeted by a team. And that's what we've been able to evolve over the last few years. It used to be if people came in here, we had limited resources in order to provide actual treatment. We could assess and refer, but we needed the ability to start medication. We needed the ability to do counseling. We needed the ability to engage them on a one-on-one basis.
I don't believe people are just born with a mental disorder. Something has to happen first. And for me, it was me being molested when I was a kid. As far as this place, it did help me out tremendously. Because and I could understand, at first it kind of upset me because I've done been in here probably 15 times, at least, maybe more than that. And they can only do so much. I had to learn the hard way, man. I kept getting drunk, I kept getting high, because I thought I wanted to. I didn't know that it was something pushing me to do all that. So when I finally just laid all my cards out on the table and told them the truth, that's when I got my help.
Especially here, the pre-arrest diversion component, so that people that are out in our communities that may get picked up by an officer, no fault of their own, they're struggling with mental health or a reaction to substance addiction, they're offered an alternative, which is the right alternative, an alternative to get treatment and to get on their feet, not to go to prison for something that truly is a medical, mental health, or substance use issue.
We've always had a really good relationship with law enforcement and the criminal justice community. It's no secret that our jails and our prisons are the largest mental health institutions. So what I love about the work that we've done is that we've looked at how it needs to be a collaborative piece.
I know nothing's perfect, but the process itself was, we can bring them, we call. They can bring them here, bring them to a secure facility. We don't even have to have them handcuffed. We treat them like a person, bring them in, they sit down, the nurses are there, the techs are there, and they can get the help they need, and we can go back and do our job and help other citizens.
I mean, you've owned your stuff. You've kind of come to realize that this was a combination of things done to you as a child that resulted in decisions that you made that were bad, and all of those things end up in the situation you're in today. But you've kind of owned all that. You get all that. Now we will be asking you and others, how do we get better? Where can we improve? And the next guy that's in your situation that isn't being treated the way we are right now. How do we find them? How do we get to them? How do we make this process better?
With the governor coming here, I hope ultimately that anything I say will help somebody else. And I believe that I went through a bunch of stuff to help somebody else, because I used to be full of anger and a whole bunch of other stuff because of what happened to me. But when I told somebody about it and got it out, it lost its power over me. That's why I told him, I can honestly say I don't have resentment or grudge against nobody in the world, man. And that right there is the most freeing thing, man, you can possibly imagine.